Hello, my name is Dr. Dewan S. Raja. Today I will discuss about Marfan syndrome. The Marfan syndrome is an autosomal dominant connective tissue disorder. The mutation happens to the Fibrillin 1 gene. Those are mapped in chromosome 15q21 colon 1. This is the locus, chromosome number 15. Okay, and the gene is the fibrillin 1 gene that is mutated, and this is an autosomal dominant connective tissue disorder. So there is a chance of 50% inheritance for if either of the parent has the defective gene. There is 50% chance of that couple's children will have Marfan syndrome. Deficiency of fibrillin 1, a glycoprotein constituent of microfibrin. There may be overactivity in transforming growth factor. About 15% to 30% cases are new mutations. Patient is tall and slender. Characteristic defects in the skeletal, visual, and cardiovascular structures and in the lungs. Prevalence is 1 in 5,000 person. Both sexes are equally affected. Okay, so now we'll look at some of the mnemonics so that we can remember that. Mnemonic for Marfan syndrome, Marfan syndrome. M, mitral valve prolapse. Here is the mitral valve prolapse. Not only mitral valve prolapse, there may be aortic valve prolapse, there may be tricuspid valve prolapse. Aortic aneurysm, aorta of the heart will be dilated, aortic aneurysm. There will be dilatation of the aorta, maybe ascending aorta, dilatation, maybe arch of the aorta, even there may be dilatation of the descending thoracic aorta. Aneurysm means abnormal dilatation of the blood vessel. Or retinal detachment. So retina will be detached. There is a possibility, and there is certainly fibrillin defect. Aortic root dilation like this, aortic root dilation. Necrosis of the aortic wall muscle. There is the tunica media. There will be cystic myonecrosis of the aortic wall, particularly the middle layer, tunica media. Spider-like fingers, we call it arachnodactyly, and toes of a tall man. This person is very tall and he has spider-like fingers. Okay, like this. His toes are also like that. Okay, we call this arachnodactyly. Synthesis of TGF beta, transforming growth factor beta. Okay, that is SYN, SYN. D, dolichocephaly, long head, dolichocephaly. Regurgitation of the heart valve, any heart valve may be regurgitated, may not be always mitral valve, maybe aortic valve, maybe tricuspid valve. Ocular changes, what happen in the eye? There will be ectopia lentis or ectopic lens may be subluxated, retinal detachment, and there may be drooping of the eyelid also possible, as well as the eyebrow may droop down. There is a possibility. So there are many ocular changes, and subluxation or dislocation of the lens is usually bilateral. Okay, there will be myopia, eyeball will be elongated, there will be short-sightedness, that is called myopia. Ectopia lentis, due to the dislocation of the lens, we'll get the ectopia lenses. So if you look at the picture, myopia, ectopic lens, hyperextensible joints. Person can extend the joint. He can touch his thumb to his forearm bones. Okay, so there is hyperextensible joint. Marfanoid habitus, tall, thin stature, arm span exceeds the height. We'll look another picture. And chromosome number 15, fibrillin 1 defect, and flat feet. Flat feet means that there will be loss of arch of the foot or feet, both side. Okay, so there will be loss of arch of the foot. And what happened? We call it pes planus, flat feet. Okay, arachnodactyly, Spider-Man like long finger. Okay, spidery finger in toes also like this. Okay, there is regurgitation, and there may be formation of bulla on the lung. There will be apical bulla. That bulla may rupture, may lead to pneumothorax. Okay, his aorta may be dissected here. We may get dissecting descending thoracic aorta is possible, or aneurysm may be ruptured and the initial part of the ascending aorta may be dilated. Okay, so here we got the mnemonic: mitral valve prolapse, aortic aneurysm, retinal detachment, fibrillin 1 defect, aortic root dilation, necrosis of the aortic wall. There is a cystic myonecrosis of the aortic wall, spider-like finger, arachnodactyly, and toes of the tall man. Synthesis of transforming growth factor beta, dolichocephaly, regurgitant heart valve, ocular changes, maybe the lens may be defective. Okay, there may be retinal detachment also possible. There may be drooping of the eyelid partially. There may be drooping of the eyebrow, that is also possible. Myopia, the elongated eye for short, that gives the short-sightedness. Ectopia lentis, there is due to the dislocation of the lens. Lens may be dislocated from the eye. Okay, that is the ectopia lentis. Okay, so if you look at the picture here, famous person, many famous person has Marfan syndrome. This is our respected president Abraham Lincoln, the icon for democracy, and he is ever memorable to the world due to his Gettysburg Address. Okay, so he was 6 feet 4 inches tall during that time. People are a little bit shorter than present day, so he was tall for his time. His dolichocephalic head. Okay, so he is a person with Marfan syndrome. Here we have other feature. We'll look at the feature here. Arm span is very much long. It is longer than the height of the person. Okay, then we'll have arched palate and overcrowding of the teeth like this. Arched palate. Okay, in the chest X-ray we'll get the aneurysm of the aorta. This is aneurysm of the aorta. Okay, and if you go to show the person's flexibility of his joints, look at that. When he put the thumb inside, thumb come out of the on the palmar margin. Okay, like this. This person's thumb is here. This is his thumb, or this is her actually. This is image taken from genetics book. The patient is a 7 or 8 years old girl, and the thumb is passing beyond the margin of the palm. Okay, this is called Steinberg thumb sign. This is a characteristic sign of Marfan syndrome along with the ectopia lentis, and certainly there may be heart problem, aortic dilatation, aortic aneurysm, ascending aorta dilatation, descending thoracic aorta is also possible, and that may be the cause of death. Rupture of the dissecting thoracic aorta rupture of the descending thoracic aorta due to aortic dissection due to medial myonecrosis of the tunica media of the aorta. There will be dissecting aneurysm of the aorta involving the descending thoracic aorta, and that may be ruptured and that may lead to death. Around 30 to 35% cases, rupture of the aorta is the cause of death in Marfan syndrome. Okay, we got that. So high arched palate. This is the Steinberg thumb. This is the aortic of the aneurysm of the aorta. This is the very much extended, very long arms, hand, upper limb span is here, very long, longer than that of her height. Okay, so we got that. So arm span is greater than the height of the individual. Okay, so arm span is a feature of Marfan syndrome. Okay, now diagnosis, workup, and treatment. Diagnosis is based on clinical feature. We don't go through the genetic testing because a lot of heterogeneity of the genetic system and the locus of the fibrillin 1 may be affected by other mutation. So best way to diagnose based on the clinical feature. Workup, we'll do echocardiography to look at the size and any abnormality in the heart. Chest radiograph will find out two things. There may be pneumothorax, okay, or there may be heart enlargement and aortic aneurysm or dilatation of the ascending aorta. Okay, chest radiograph. Transesophageal echocardiography is good for diagnosis of the dissecting thoracic aorta, descending thoracic aorta dissection, that is done by transesophageal echocardiography. Ophthalmic examination is a must, so every year, once or twice, the person should go to the ophthalmologist or maybe optometrist. Mostly it should be preferred to go to the ophthalmologist to assess for the location of the lens and any other abnormality in the eye. Okay, so that is very important. Treatment, regular medical checkup, restriction of the contact sport and weightlifting that may rupture the aneurysm of the aorta. Beta blocker has a very good role. It decreases the heart rate and maintain the normal pressure, try to maintain the normal pressure through the ascending aorta and the descending thoracic aorta. ACE inhibitor is a very good medication for the patient with Marfan syndrome. Monitoring during pregnancy. During pregnancy, there will be hemodynamic changes, more body fluid that may damage the aortic aneurysm, okay, or may cause damage in other places. So monitoring during pregnancy and genetic counseling, as because it is an autosomal dominant disease, there is 50% chance for the babies from those parents. At least one parent has one defect that is autosomal dominant that may be transmitted to 50% of children. Okay. And that's all about the Marfan syndrome. If you have any question, please feel free to ask me. Please support my channel. Please subscribe me. Have a nice, wonderful and blessed day. Bye now.